touch. I will have good diet, then I will do exercise also, then I will try to be stress-free also. And then even if my parents have diabetes, I may escape that diabetes because I am
Exactly.
maintaining a good lifestyle.
A decade back that we had people after the age of 50 developing diabetes mellitus, now it's like 30. The cutoff has like reduced over 20 years.
Hello everyone. In today's talk with medical experts, we have with us Dr. Suma. She's Assistant Professor of Physiology in Savita Medical College, Chennai. She's also a practicing physician, a medical teacher, and my old friend from MBBS days. So welcome Suma. Thank you so much for joining us today.
Thank you, Mamta. Thank you for having me.
Suma, can you tell us about the different hormones which are there in our body, something we should all know about?
Yeah, so there are plenty of hormones in our body which actually are playing a vital role in maintaining what we call as the homeostasis of our body. So beginning from the pituitary hormones, we have growth hormone, insulin, which most of the common people would be knowing. And then we have the other pancreatic hormones like glucagon, somatostatin. And then we have the thyroid hormone. Again, the thyroid hormone disorders are again on the rise as we see much in the clinical practice. Cortisol, again, the stress hormone. So with the recent era of increasing stress in the workplace environment everywhere, so there's also increase in the levels of cortisol. And again, in a breastfeeding mother, prolactin, oxytocin, the role of how milk secretion happens. And yeah, again, our normal sleep regulation again is enhanced by melatonin secretion. So there are plenty of hormones, like although they are in very nanoparticles, they're secreted in very less amounts. They do play a very important role in maintaining what our daily life is.
Oh, that's great. Okay. So for sleep, we have melatonin. For growth, we have growth hormone. For our, the regulating our blood sugars, we have insulin. Then
Yeah.
for breastfeeding mothers, we have, yeah, oxytocin and prolactin.
About the calcium homeostasis, again with the rise in osteoporosis, all that, we also need to know about the hormones which regulate calcium. That includes your parathormone, vitamin D, calcitonin.
As today's topic is more about diabetes, so why is everyone getting diabetes these days and which hormone is important in that? Can you tell us?
If we look into the recent statistics in India, every seventh person would be having an altered glycemic level. That's what the studies say. So basically, we have entered into a diabetes era and also an obesity era where we see people consuming plenty of junk food and fast food, which alter their blood sugar levels, and they end up with having diabetes mellitus. Also in the clinical practice, I see that wherein a decade back that we had people after the age of 50 developing diabetes mellitus, now it's like 30. The cutoff has like reduced over 20 years. So even above 30 years, the adult onset diabetes is what we are seeing. So the reason is mainly because of the lifestyle. So also we know that it's a lifestyle disease, and it has got polymorphic inheritance. Also, it is polygenetic, and there are plenty of factors influencing over it. Coming to the stress, also the increase in the junk food and other glycemic index foods which have a high glycemic index, and lack of exercise, sedentary lifestyle. And so these are the common factors why we find an increase in the diabetes level. And the main hormone which is responsible for maintaining the glucose homeostasis or maintaining the glucose level under cutoff standards is insulin. So insulin is basically secreted from the endocrine part of the pancreas, insulin. And insulin, the main role of insulin is to enable glucose uptake into the cells, thereby decreasing the blood sugar levels. So once there's a decrease in the insulin levels, the blood sugar level goes high. And the increase in the blood sugar levels actually cause vascular derangement. So basically, we would refer in medicine as diabetes mellitus. The only problem is not the increase in the blood sugar level, but the four complications or the vascular complications that it can cause.
we have gathered is insulin is secreted from pancreas, which is a very important gland in our body. So now insulin is responsible for controlling our blood sugar levels because of lifestyle, because of improper diet and lack of exercise and even stress. So insulin is secreted by pancreas, and it can be either decreased secretion of insulin, or the insulin which is there, the body is not responding to it. So this
Yes.
makes two types of diabetes, is it, Suma?
Yes, so that's how it makes two types. The first type is where it's an autoimmune disease. When we say
Hmm.
autoimmune, it means your body's own immune system is attacking your own cells. So here there is destruction of the beta cells in the pancreas, which is a gland which is secreting insulin, and
Hmm.
therefore there is reduced secretion of insulin. And that's what is your type 1. And here the basic treatment would be to supplement the patient with insulin. So that is insulin dependent diabetes mellitus. And the next type is generally the adult onset diabetes mellitus, where the insulin levels, although they are normal, but the resistance develops at the level of receptor. So insulin is not able to act on the peripheral cells, and therefore glucose cannot enter inside the cells. So if glucose is not entering inside the cells, the glucose level in the blood is going to be high. So that is why
Hmm.
hyperglycemia or increase in the level of glucose in blood. So this is non-insulin dependent diabetes mellitus or type 2 diabetes mellitus. So generally we see that patients who have their parents with diabetes mellitus, they
Hmm.
also generally tend to inherit it. So that is one cause. And on top of that, the entire hormonal regulation is altered when your lifestyle balance is altered, when there's stress hormones, like when you're in a good amount of stress in your regular life all the time, then it becomes your cortisol levels are high. When your cortisol levels are high, again, that induces an increase in the glucose. So it's kind of too many factors, or we call multifactorial disease. So
Hmm.
there's not one thing which is pointing on to like any other bacterial infection or so, where we can name a single bacteria. It is not like that. So it's a lifestyle disease where there are plenty of factors coming into action resulting in this disease.
Okay, so it's not that my parents have diabetes, so I will get diabetes.
So although if you maintain a good lifestyle and if you have your glycemic index under control, then definitely you will not have diabetes mellitus. So there is no rule.
Mhm. Okay, so there is no set rule. So I have so many factors. So if
Yes,
I can, with my good lifestyle, if I can regulate, acha, I will have good diet, then I will do exercise also, then I will try to be stress-free also. And then even if my parents have diabetes, I may escape that diabetes because I am
exactly.
maintaining a good lifestyle. है ना?
Yeah,
So,
yeah, true.
so along with genetics, our lifestyle is equally important when it comes to diabetes.
True.
Okay. So when do people need insulin injections? Like some people take medicines, but some people take injections, no? Insulin injections. Why is that?
Yeah. Now this depends upon how your body is acting and how your body is responding. So generally in very early stages, what we call as pre-diabetes or so, when the levels are only a
Mhm.
bit high, generally with exercise and food modification itself, you can bring it under control.
So patients are not compliant many a times. Matlab, even if you say, "Acha bhai, correct your diet, do some exercise," they're not listening, is it?
Yes, they do not. It's not like they do not listen. See, basically, if you're having a fever or a cold, you feel something abnormal with your body, and generally you tend to seek help. Whereas this lifestyle diseases like diabetes, hypertension, and all, many a times, whatever set symptoms that we read in a books, patient do not exhibit any of the symptoms, and they feel absolutely fine. So it is very difficult for them to make them understand that they have a disease and they need to do some lifestyle modification in order to avoid it. So there comes the problem.
Okay. So, what are the different symptoms of diabetes? Suppose I feel like, okay, do I have diabetes? Do I have to get it checked? Are there any warning signs or any symptoms, Suma?
Yeah, of course. There are warning signs. In general, the adult onset diabetes mellitus, the common warning signs are, see, now I'll also explain you in simple terms. we just mentioned that the basic problem here is your insulin is not acting on the blood glucose, and blood glucose is not entering inside the cells. Okay. So now in your brain, there's a structure called hypothalamus. And in the hypothalamus, there is a center which is actually known as the satiety center. So the satiety center is nothing that tells you that, okay, you have had enough food. Now you can stop eating food. So that's what is the
Satiety.
word satiety means. Yeah. So
Okay.
when you feel full, stomach full, so that's what you tell it as satiety. Now, what happens in a diabetic is just like the glucose is not entering any of the peripheral cells, glucose cannot also enter inside the cells which are located in the satiety center.
Okay.
So the satiety center is now having no way to realize that the blood glucose levels have already increased and the patient has had enough food. So since the satiety center is not going to receive this feedback and it is not going to give any signals, on the other hand, the feeding center is continuously active. So your feeding center keeps telling you to have food. Now that is the problem, which we call as polyphagia. So patient tends to eat a lot when you feel that your hunger levels have increased, when you're consuming more food than what you used to do. So that is a warning sign. And then the other common thing which generally people also have called polyuria. Okay, where
Polyurethane.
you tend to urinate a lot. Now, if you look at the reason for this, so when the blood glucose levels are very high, see, generally in your kidney, the reabsorption or how much glucose is taken back into the blood is 100%. So there has to be no glucose in the urine. So if any person is going to go for a urine test and look for the glucose levels in the urine, it has to be zero. It has to be nil. But what happens here in diabetes is, since the blood glucose levels are so high, they cannot, your kidneys I mean, the nephrons, they have gone beyond the extent to which they can reabsorb. So glucose starts appearing in the urine. And glucose is an osmotic agent, so it tends to imbibe more water with it. So that is why patient tends to have polyuria. So the other common sign which you can anticipate if you can have a diabetes mellitus is if you feel that you are urinating a lot. So polyuria, polyphagia, and the other common thing is when you feel, see, because you are losing excess of water from your urine, generally your body water levels are going to be low. So the person tends to be thirsty. Okay, so he tends to drink plenty of water. So many times patients are well aware of this symptom. So that's what I see in the practice. So because I have patients who have come and told me these symptoms very clearly. So, in the past 1 year, I've like lost 10 kgs of weight, and this looks, I haven't done any kind of a dieting. Also, I'm eating, or although I'm eating more, and then I've lost this weight. Also, I feel that I'm urinating more, and I feel very thirsty all the time. So these are the common symptoms which can happen when your blood sugar levels are high. Now, this is where when there is a milder increase. Now, when you look at people who are in a peripheral setup where they do not have much access and awareness about any diseases, the blood sugar levels are so high, and then they tend to walk barefooted and they develop an injury, and then that results in a non-healing ulcer. And that is when you like come into looking for the blood sugar levels, and you find that he is diabetic and therefore the ulcer is not healing. And in that case, it has gone into the complicated stage where the nerves have been affected, and you call that as diabetic neuropathy. So the symptoms are much varied depending upon the educational status of the person, and also from where they are hailing, and the level of blood glucose.
Okay, so the warning symptoms can be that you are getting so hungry, you are losing weight and you're eating a lot and you are urinating a lot, means you're using the bathroom so often. Okay, maybe I think more than once in the night also, Suma. That counts,
Yes,
right?
yes. Yeah,
So more
yeah,
than once or
that
twice
does count.
in the night also, and then you are so thirsty, you're always hungry, you're always thirsty, and still you're eating but still you're losing weight, isn't it? Okay. And
Yes.
then suppose, so this is in the milder form, so when the sugar level is somewhat high. but in the periphery where we don't have enough services, and people ignore these symptoms, and then later they progress to a higher stage and a complicated stage of diabetes. So at that time, your nerves, so the nerves which are at the periphery, in your fingers, in your toes, or in different system, different organs like your eyes, your kidneys, so any of the organs can get affected in diabetes.
I want to add one point. Now, as I told you, the symptoms of diabetes mellitus.
Mhm.
Now, there is people also need to understand that we have something called as the metabolic syndrome, wherein the patient may not be thin, he may not be losing weight. Rather, he could be
Mhm.
an obese individual. Right. So now again, see, my own father used to have a doubt. Okay, he's quite obese, and then he used to tell once he was diagnosed with diabetes. I've heard that diabetes people generally tend to lose weight and they are very thin. But
Mhm.
I'm not like that. I'm quite obese. Then how do I have diabetes mellitus? So now where your metabolic syndrome comes into play, where the person is obese, right? And
Mhm.
because of obesity, he has ended up with stress hormones, and then there is an altered glycemic level along with hypertension also and altered cholesterol levels. So altogether ends up in an vascular or an vessel disorder and therefore diabetes. So what I'm trying to tell is there is no hard and fast rule as to this is the absolute symptom of diabetes mellitus, but of course
Mhm.
you should not ignore any symptom that you really feel.
Okay, so the individuals can even be obese plus stressed out, है ना? And but will they still have, too much eating and too much urinating? These symptoms will be there even
Yes,
if they
that
are obese.
still can be there. Yes, polyphagia and polyuria can still be there.
Mm-hmm.
See, now once the blood sugar levels are high, they attract your body's immune system. All this end up in depositing things inside the intimal layer of the artery, and therefore the artery becomes thickened, and that is where the complication arises.
Okay, so artery thickens and the blood flow decreases. So in the complicated form of diabetes, so now you have let your diabetes progress so much, Kina, your blood vessels have been affected. So you're ending the nerves which are supplying here or to your organs, they are not getting enough supply. So a lot of complications can happen. So for example, one is ulcer in the foot, so in the extremities, in your feet you can get ulcers, and then in the eyes, what do we get? We can get retinopathy, so that can itself cause blindness if you're not careful. And then what happens to the kidneys? In the kidneys you get nephropathy. What happens because of that, Soma?
See, diabetic nephropathy is a condition where the increase in the blood sugar levels over a lot number of years can affect the nephrons. See, in the nephron, there's a structure called as the glomerulus, and there are glomerular capillaries which actually filter out the urine. So once the capillaries are affected, your filtration is affected. Also, did I tell you that the glucose generally is absolutely not excreted in the urine? So if you check for the urine levels, there has to be no glucose.
Glucose.
Similarly, yeah. Similarly, most of your proteins are also they are not filtered into the urine. So the proteins do not pass into the urine. But what happens in diabetes mellitus? Since your capillaries are affected, so the proteins are now making a way inside the urine. So the person has to go and check for a urine routine, and then if he finds protein levels in the urine trace, and then you have like 1 plus 2 plus, now that depends upon the severity of the disease. So
Hmm.
as the protein levels in the urine are high, now that is an indication that you are progressing towards a stage of diabetic nephropathy.
So we talked about complications on kidney and on the eyes, that it can affect the retina, and also about the foot, that it can cause diabetic ulcer, and if that does not heal, that can even lead to amputation. Some people still do not control their diabetes, and that ultimately can even lead to amputation, cutting off their foot.
The neuropathic symptoms usually they start as like numbness, tingling sensation, and sort of a pain.
Hmm.
And only when patients ignore that, then it progresses to become that the patient is not able to feel sensations over there. So even if they are able to pick up in those early stages, again, it could be prevented. So
Hmm.
that is one thing. And once the sensation really goes off, especially in the peripheral toes, heels, and all, and then they develop an injury and they are not aware of it since they are not able to feel it. And that is when it goes on progressing as an ulcer and it becomes non-healing. And again, that the patients do not have awareness that it is a non-healing ulcer and it has to be debrided. Now, even educated patients, they do have diabetes, then they have developed an ulcer, they're not ready for a debridement. So they feel that there is a black colored scar or something covering over the ulcer, and they feel that it is healing. You know, only when we enable better blood flow over there and we remove off all the dead tissue, that is when the ulcer is going to heal. So after the ulcer is formed, getting treated properly in order to avoid amputation. So that is also an important thing which I want to enhance.
And anytime the ulcer is having dead tissue over it and your doctor asks that this needs to be removed, this needs to be cleared up, only then your ulcer will heal properly. So that is the meaning of debridement. So that needs to be done so that your ulcer gets new and good blood supply and it can heal. Yes.
Yes.
And if
Yes.
you do not follow the instruction, if you do not do this dependent, nahi, it is healing, we don't need anything, then the infection can progress. It can lead, become a severe infection, or more and more skin will get affected, and your leg can get amputated at last if you are not careful about it.
Heart attack or myocardial infarction. So in heart attack, here what happens is, again, the vessels supplying the heart are affected and that part of the heart muscle dies. That means the heart is now no longer able to beat properly in order to pump blood. Generally, when any other person develops this sort of an heart attack, there is an excruciating pain which the patient has.
Mhm.
Now, the problem in diabetes is that since the nerves are also equally affected, the person can also end up with a silent infarction. So they can have a infarction, that is a heart attack, but they may not feel pain.
Oh my God.
That is very dreaded complication of diabetes mellitus, what we call a silent infarction. So many times we find patients suddenly passing away if not given proper attention at the right time.
A silent heart attack, so that is so dangerous. Like suppose when people have, okay, I have chest pain, this and that, and then at least they go to the doctor and see that, acha, I have chest pain, get me checked, do the ECG, then they get their blood levels, blood sugar, blood cholesterol, everything. But when you have a silent heart attack, like we don't even know, it's not paining, so then we don't know it's that our heart is getting affected. It is such a serious thing. So this can also happen because of diabetes.
And apart from that, also people should understand that diabetes is a condition where your immune system is compromised. So it's an
Oh.
immunocompromised condition wherein you are prone to develop multiple infections. So the other common thing that we notice in clinics is people with diabetics tend to have plenty of fungal infections. So all the what we call as opportunistic infections. So when your immunity goes down, you have the common commensals, common organisms in your body also, they start flaring over and you have infections. So plenty of infections. So you need to be aware of that. And then there's something called as the frozen shoulder, where people can have pain in the shoulder. So that is also a warning sign. And then if you're getting repeated infections, as I told you, repeated boils in the axilla, repeated folliculitis or repeated abscess. So all these are again indications that your immunocompromised state is there and you're developing repeated infection. So it's always good to get a blood sugar levels checked, and it can be cause of diabetes mellitus.
Okay, so diabetes has so many hidden signs and symptoms also. So you have to take a clue. And one more thing, like if you would have heard of tuberculosis, TB, which the diabetics even get prone to TB because your immunity is decreasing. Now the TB can easily attack you. Normally, if your immunity is high, there is less chance of TB attacking you. But if your immunity is low, then you can even get tuberculosis along with diabetes. So generally, people with diabetes also should get for get checked for TB if their doctor says so. So opportunistic infections, as Dr. Suma said. So it is like anyone, suppose the door of your home is open, huh? If you're not standing guard there, the door of your home is open, then anyone who is passing by can say, na, ki, acha, let's go inside, let's check out. So they are taking the opportunity because your immunity is gone. The fungal infections. So like to avoid the diabetic ulcers or in the foot also. So generally for the diabetic patients, we say that do not keep your feet wet also. And in between the toes also, you have to dry your skin, keep them dry. Otherwise, you can easily get fungal infections there. So now suppose someone already has diabetes, then what are the things they should be careful about? Hmm.
Yes. Okay. So when someone is a known diabetes mellitus and is on treatment, so the treatment could range between oral hypoglycemic drug, where it's a medicine in a tablet form, where the patient consumes, the blood sugar levels are adjusted with that, or when the hypoglycemic agents are of no use to the patient and still the blood sugar levels are high, then the doctor would opt for an insulin. So in either case, whether you are on an insulin therapy or you are on oral hypoglycemic agent, a very important thing what I would like people to know is that you should be aware of hypoglycemia symptoms. So what is hypoglycemia? This is what we call when your blood sugar levels are very low. So sometimes what do our patients do is a few times they become really aware of their condition and then they want to get control over, and for they cut down on their diet so much, and on the other hand they would have been non-compliant over a period of years, and the treating physician would have put them on a stronger dose of drugs. Now when this mismatch is there, that you have gone into a very low diet, calorie diet, and then your drug is of a superior dose, and then there is chances that you are taking drugs which are going to lower down your blood sugar very much low. Okay. Now, even in a fasting state, your blood sugar levels should be greater than 70. Now, if suppose you are taking drug and also not consuming food properly, or you're taking insulin and not consuming food properly, or on an occasional day that you are out, you are working so much, you're into some very strenuous activity and you have not eaten anything since morning or so, but still you have taken the tablet or insulin, now there is a very dreaded complication of hypoglycemia where your blood sugar levels are low. So generally, people are not aware of this. So hypoglycemia, see, when you have high blood sugar levels, the complications that you're going to get are in years. After so many years of progressing, your end organ damage will be there. But in case of an hypoglycemia, you can immediately affect that. The condition can immediately affect your brain, because glucose is the main fuel to your brain. Okay. So if your blood sugar levels are so low, then your brain is not receiving enough amount of fuel. There is chance that your brain dysfunctions. Symptoms like you feel little bit uneasy, you can feel dizziness, a headache, dizzy, a little bit of disorientation. Now, when the blood sugar levels are very low, less than 50, the patient can become disoriented. Disorientation is not know where you are, what is happening around you, are not having awareness about your surroundings. So that is all this can happen. So now this is again a very important thing. So I would like to advise all the patients who are on diabetic medicines or insulin to always carry a sachet of a small glucose tablets or a glucose water, or at least a chocolate or something with you. So anytime you really tend to have a little bit of uneasiness or something like that, I would recommend you to immediately take this so that your blood sugar level rises. So also do not be very keen on lowering your blood sugar levels very much. And the other saddest part on the treating doctors also, I would say that because physicians end up giving patients with higher doses of polypharmacy, wherein you are adding more than one group of drugs, and we are not taking a proper history of the patient and their exact dietary habits. And so because of this mismatch, again the patient can end up with a hypoglycemic episode. So this is something both the patient and the treating physician should be conscious of.
When your blood sugar levels have dropped down, so at that time you can also have palpitation. Matlab, you will feel your heart pounding like that, and you can also have excess sweating, and you can also have hand tremors. Okay, so there are many symptoms of hypoglycemia. Whenever you feel that you are having hypoglycemia, so first of all, you do not be in a dangerous situation. Suppose you're driving, park the car. If you are going in the middle of the road, you just go and sit somewhere. So first, don't be in a dangerous situation where you can get injured if you fall down. Okay, and you can sit and you can have a tiny bit of chocolate or something sweet which will give you some sugar level, so that you go home and have your meal. Till then you will be okay. So now finally, can we tell people how to not get diabetes? What are these lifestyle changes which we should do in everyday life so that we have less chance of getting diabetes?
Now we understand that anyone can get diabetes mellitus. Okay. So when your parents are diabetic, you need to be all the more careful because we did mention that it is also a inherited disorder. So apart from that, regular checkups. See, the symptoms that we all had mentioned, of course, you need to be aware of that. But many a times patients do not experience any of the symptoms, although their blood sugar levels are high. So getting a blood checkup done for blood sugar levels at least once in a year, I would recommend. So that would actually help you in a long way if at all there is diabetes mellitus in diagnosing it.
A decade back or 20 years before, people used to get diabetes after 50 years, but now that has come to 30 years. So after 30 years, should we get it checked like every year or like every 3 years if we are normal?
No, I feel even if you are absolutely normal, please get a routine blood checkup done every year. So that would help a long way in picking up cases at the earliest and preventing any sort of complications in the later years. So that's one thing. And as I was mentioning, there's pretty much disturbed work-life balance in this era, since people are working for a long number of hours, and spending less time on any kind of an entertainment or refreshment. So they end up getting stressed a bit. So, and I would advise to take ample amount of breaks and your health as well. So definitely make sure that you give good time for your relaxation. So that is one thing. And then coming to food habits. So again, if you're going to correct the kind of food that you're going to consume, generally that takes a long way in preventing not only diabetes mellitus, of course, plenty of other complications and other diseases also. So make sure that your carbohydrate content in your diet is under control. Do not end up eating only carbohydrates for all your 3 meals. Include plenty of vegetables in your diet, green leaves in your diet. And also in diabetic mellitus, another complication is what we call as gastroparesis. So gastroparesis means the motility of the intestine is a bit delayed. So when you're going to consume more amount of vegetables, especially green leafy vegetables or what we call as dietary fibers, so this dietary fibers would enable the bowel movement very food, like divide your plate into like 3 halves and make only a small portion of your carbohydrate meal. Yeah.
Rice or chapati should not make all the meal.
We have plenty of millets, ragi, and other kind of millets. They're also having a low level of glycemic index. So people can have a variety. So person can consume rice maybe once in a day, but the quantity is more important here. See, if you see, although the glycemic index of wheat and rice is not very variable, the quantity actually matters. So you can ask the patient to consume chapatis in the evenings and afternoon, maybe a small cup of rice and plenty of vegetables. And mornings, you can opt for this kind of millets. So millets dosa or millets upma, something. So that would be a variety for them. Now, on top of that, sedentary lifestyle has to be totally avoided. And you'll have to work out a lot, walk a lot, and so count your steps at least more than you can begin with around 5,000 to 6,000, and then you increase up to 10,000. So that much of walking and steps a day is required to keep yourself healthy. I have to sit and work, but please take breaks in between and keep moving around. So that also helps a long way in preventing.
Sometimes the elderly or someone, if they have a movement restriction, I have knee joint pain, I have this pain, that pain, I cannot walk, I cannot do this. So it's not that if you cannot walk, you cannot do exercise. You can sit and also do exercise. Even doing a little bit of walking also counts. So suppose you are not doing any walking at all and you start doing even 500-meter, 1 kilometer a day, that affects your health, has a positive effect on your health, okay? And your blood sugar levels will start getting under control. So as Dr. Suma said, not only carbohydrates, matlab this much rice, this much chapati, no. You have this much chapati, then you have this much vegetables along with it, okay? So make different varieties of food. Eat, have diet diversity in your food. So you get different type of nutrition. Okay. And anything about people who have a lot of non-veg?
You cut down on the broiler chicken and consume good native meat. So that should do. We cannot compromise on anything. Balanced diet is the key. But just that we end up doing overeating on a particular thing. So just to avoid that, and quantification of meals. So if you're going to quantify your meal and have in little amounts, and especially in diabetics, they have to take frequent meals and which are of smaller portions. So now generally we are tuned to having 3 meals in a day. So in a diabetics, they can increase the number to around 6 to 7 and decrease the quantity. So that also helps a long way in decreasing the blood sugar rise at once.
So anyone who has diabetes, no fasting, no feasting. Okay, do not do total fasting also. Do not do too much feasting also. No, today I have to attend this marriage, I have to eat all of that. Then it's your body, your blood glucose, you're going to suffer for that. Okay, no, we cannot take that chance in diabetics at least. Okay, so have small frequent meals, have diversity, have all the nutrients, different type of nutrients, and always remember that local regional food is always the best. It's not that you have to get some apple from California and some avocado from different country. No, whatever grows in your region and the green leafy vegetables which are growing, they are the best for your body. So nature has given us whatever we need within our reach. Suma, you have given us so many valuable details about diabetes and having a healthy lifestyle. I'm sure all our viewers will get big benefit from watching this talk. And don't only watch, take some points and use them in your day-to-day life. See, it's your health and health is wealth. So I wish you a very rich life in terms of health. Okay, so thank you so much, Dr. Suma, and we will definitely have another session on another interesting topic in future.
Thanks a lot. So it was good talking. And if this is going to make a difference in at least the people who are watching, if you're going to understand the early symptoms and how to prevent and what are its complications, so that would be a reward. Thank you. Thank you all. Thank you for the opportunity.
Thank you so much, Suma. Thank you, everyone. Take care and be healthy and happy.